how early NHS collaboration shapes healthier communities. So just a couple of housekeeping points before we begin. The session will be recorded, just to let you know, and we will have a Q&A session at the end of the webinar. And so for that part, if you just pop your questions into the Q&A section as opposed to the chat, they will then be picked up and we can ask our panel the questions. So my name is Liz Wright, and I'm going to be hosting the webinar today. My aim is to speak as little as possible. And we're here to explore how early engagement with health partners and co-creating services can transform the way that we support people in our communities, especially those living with long-term health conditions, disabilities, and those who aren't walking through the doors of traditional settings. But before we get into discussion, I'd like to hand over to our panel to introduce themselves. So if you could just share your name, your organisation, and a little bit about your role, that would be great. If we start with Greg, then go to Julie, followed by Linda, and then Fiona and Wendy, who are on the one camera. And then once we've heard from everyone, we'll move into our first question. So over to you, Greg.
So good morning, everybody. My name is Greg Russell, and I work for East Ayrshire Leisure as a strategic lead for communities, and I oversee the remit of all our sport and leisure facilities, libraries and community facilities. So,
Thank
Julie.
you.
Hi there, my name's Julie Noble. I work for East Ayrshire Leisure. I am Lifestyle Hubs Development Officer for the Trust, and I oversee operations for 4 venues. I've got 6 fitness suites and a group exercise timetable.
Thanks, Julie. Linda.
Morning, everybody. I'm Linda Chisholm. I'm the strategic lead for community wellbeing within East Ayrshire Leisure Trust. Just moved over from the council to the Leisure Trust on the 1st of April. Role will be to oversee a lot of the work that we're doing around about community health, whether it's in facilities or out in our communities.
Excellent. And last but not least, Fiona and Wendy.
Hi, good morning. I'm Fiona Holloman. I am the team lead for the physiotherapy MSK service in East Ayrshire. We're based at Crosshouse Hospital in Kilmarnock.
Hi, I'm Wendy Carswell. I'm a physio assistant practitioner. I also work in MSK Ayrshire and Arran, and I've been lucky enough to be part of the first programme in the Active Wellbeing Suite.
Thank you very much, everyone. We're excited to have such a learned panel. So let's dive into our first question. So Greg, you identified a gap in East Ayrshire, a need to better support people living with long-term health conditions, disabilities, and those who weren't being reached by your traditional leisure programming. What was the moment that made you realise that things needed to change?
So I think probably it was when I started my previous role back in 2002 as a development manager. I think what I'll do is I'll bring up some slides that'll just help kind of talk me through the journey as to how we came to that, if that's okay. So give me 2 seconds and I'll try and hopefully share this possibly.
Hopefully all goes smoothly with the technology. Yeah, we can see.
Is that working okay?
Perfect.
Yeah, okay. So I guess maybe give a bit of context around about East Ayrshire in itself. And we are based in the southwest of Scotland, population of about 122,000. And the Leisure Trust was established in 2013. We have quite a large remit of facilities, ranging from libraries to concert halls to country parks, and also now establishing some active wellbeing hubs. When I was in the role, the remit that we had with the sports facilities, Stewarton, which is the largest, third largest town for East Ayrshire, population about 6,500, sits within the Alnwick ward. And one of the areas that we were looking at was the sort of older age population, and this was sort of where the kind of premise of this started, and the gap, if you like, through our market research. So back in about August 2022, we were looking at sort of some solutions, and discovered Innerva, which was Shape Master at the time, and that kind of concept of having something in place for the older age population. As leisure providers, you know, we understand that it's not just about the active age population. It's putting strain on the health and social care services, but prehab and rehab clients, for example, individuals with mobility challenges, long-term health conditions, rehabilitation and mental health struggles. So we felt we had a vital role in trying to ease that pressure. However, these groups tended not to have the confidence to come into the conventional gym setting. So that's where we started sort of looking to say that, well, there's a bit of a gap in the market here. I've been attending seminars that were talking to us about, you know, it's kind of moved on a wee bit now, but the penetration rate within fitness was sitting about 15%, and you know, the leisure industry was starting to come closer to health of pre-COVID, and also that we also need to tap into the older age population for various reasons as well. So that's where it kind of started for me, and looking at sort of where or what we can do to try and engage those people, to try and get them to come into the facilities as well. So talking through the sort of journey side of things, we came across a funding opportunity in October 23, and we wanted to use that to try and do something a bit different. And you know, that was where our starting point was there, and looking at solutions and the Innerva side of things about how we then engage with, at the time, the healthcare partners to try and make that going forward. There.
Yeah. So, thanks for that, Greg. I think that it's really useful to have that context of kind of what got you to the point of wanting to do something differently, and it highlights the turning point that got the work that you're doing moving. I suppose my next question is once you recognise this, how did you then begin engaging with the health partners? You've obviously mentioned the funding already, but in terms of actually engaging with specific health partners, what was it that you did differently?
So when we talked about what we were looking to do when we had the funding, and we wanted to engage with our health partners, I think the approach that we took was that we had to think like health care partners and not leisure providers to be able to pitch the idea. So the approach we took was very much persistence in terms of getting to the right people within the health care world, if you like, through our health and social care partnership or NHS partners, and actually pitching it to them in a way that would help them achieve their outcomes, as opposed to what we were trying to achieve as a leisure provider. So that was around about sort of pitching an idea around about the Caring for Ayrshire delivery outcomes and the public health priorities, to demonstrate how the wellbeing hub concept that we were coming up with, initiative that we were coming up with, would help them achieve that. And we made it very clear very early on that this wasn't us as a sales pitch to then start trying to charge them to come and use the facility. I didn't want to have money as a kind of a topic of conversation, which I think sometimes can and probably distance people quite quickly because of the lack of funding that everybody has there as well. So obviously we'd found a funding opportunity to do the concept. So this was about working with partners to achieve common outcomes that would then get everybody an invested interest into what it was we're trying to do. And also very early on, as you can see there, so January 2024 was when we started trying to have conversations around about the wellbeing hub and how that would work for everybody there as well. So this was about getting patients, individuals, what I was discovering about out of a hospital setting and into a community environment, and how this wellbeing hub would allow us to do that. And it was then about trying to work with our healthcare partners to bring those people through the door that would normally come through the door, make them feel comfortable within the facility, to then hopefully retain that longer term retention for them to then eventually look to maybe sign up to one of our memberships as well. So
Excellent.
just the starting point there was that first meeting, and that was quite an important meeting to get people along to actually then talk to them. I'll be honest with you, those meetings were about first sort of introductions of actually meeting individuals. My remit was very much about having facilities, and we had the facilities and the spaces for people to come and do things. Whereas our colleagues within the chat team, Linda, who were still sitting with the council at the time, and our health and social care partners, they didn't have spaces, and they were struggling for spaces to actually be able to deliver programmes as well. So to bring individuals along and then pitch the concept of what the Wellbeing Hub was going to be about and the vision of that and how the partnership working would work, and then looking to say, right, well, what would everybody like to get out of this, was the key starting point for us to then be able to drive that forward in terms of how we work together. And this wasn't about us producing the Wellbeing Hub and then individuals coming to use it in terms of our healthcare partners. This was about us all going on the same journey and feeding into how we set the hub up, how we operated it, the pathways that we had for clients, and how we mitigated those barriers that were in place for those individuals, and we tried to work together to try and overcome that. And I think that's where that strong partnership started from, because we were all in it from the start, as opposed to bringing healthcare in sort of halfway through it.
Absolutely. And I think looking at that timeline, it's really clear to see that how early those conversations started. And you've already mentioned, you know, that shared understanding and that co-creation of what you've now kind of ended up with has clearly made all the difference. I mean, for those, I attended the opening day of the Active Wellbeing Suite in East Ayrshire, and I've never seen so many health partners all in one room, all invested and kind of keen to kind of make it a success. So it's so encouraging to hear the work that you've done, kind of the impact that it has so far. And this is very much kind of the start of the journey, really from an operational perspective. So thanks for that, Greg.
I think also just to point out as well is that when we even did everything we did, so engagement with yourselves around about the Innerva suite, the training that was provided with it, our partners all attended that as well. So it wasn't just our staff on site, it was a session where our staff on site, our colleagues within our active lifestyles team, the chat team, our colleagues at health and social care all came together for that to be delivered. So yes, it was quite a large group, and it was a really good day that we had, and it just started building those relationships between the various partners as well. And I think that's then shone through right the way through to the current day in terms of how everybody's working with each other, and it's very much a partnership facility now.
Which is amazing, and we were blown away by the attendance at your training session, so much so that we're kind of now putting it into the best practice guide to actually invite health partners along to that training session, because like you say, from an engagement perspective and understanding the pathways, the product, the service, it's all complementing kind of the success of the outcomes of the end users, but then also the setting as well. So good. Well, thank you for building such a clear picture of the background of East Ayrshire, kind of the conversations that you had, and kind of what you're doing. I want to move on to the next person on our panel, Fiona, because you were actually involved in one of the first trials that put this all into action. So Fiona, can you tell us a little bit about the trial you first undertook within East Ayrshire?
Thanks, Liz. Yes, so after being involved in the, as Greg pointed out, all the planning for this, we had already done partnership working and done a bit of collaboration with some of Linda's team within the community health activity team. So we had a osteoarthritis is a big referrer for us within MSK. So within our locality, OA knees were a significant number on our waiting list. So we used that as a feed into the project. So what we opted to do was move things out of the hospital. So we set up an 8-week collaborative programme. So that was going to happen every Tuesday afternoon up at the Rose Riley Wellbeing Suite in Stewarton. And that's Wendy, who's with me today, is our physiotherapy assistant practitioner. So Wendy teamed up with one of the instructors from Linda's team.
There we go.
So with Kelly, so between the two of them, they delivered a 45-minute exercise session within the suite, and then that was followed up with an opportunity for tea and coffee and an informal chat, which really set a good situation where Wendy was then able to deliver sort of health education topics relevant for those living with arthritis. So Wendy, we had already invested in health behaviour change training within our team, and heavily invested in that in the year preceding. So that really put Wendy in a great situation where she was able to cover subjects such as helping people to understand arthritis, understand their pain, flare-ups that they might anticipate, looking at food and inflammation, anxiety, managing activity and sleep. So for the patients to access this trial, we use the activity on prescription referral form. So that gives the opportunity for registered health professionals to refer into the community health activity team. There is also the option for some self-referrals. So for that first cohort that we did on this test, there was 11 referrals came from our MSK service. 2 of those came from local GPs and 2 people self-referred onto the programme. Over the 8 weeks, we were astounded because 91% of the sessions were attended. Out of the 15 participants, 13 of them completed. 2 of them had to withdraw, but that was down to other morbidities that they were dealing with at the time, but they both intimated that they wanted to be considered for follow-up sessions. So it went really, really well for us. So I suppose the thing was then for us, why did we feel that we wanted to go down that way? So I think with the slide that we've got here speaks volumes. So 48% of adults in Scotland are living with one or more long-term condition. Within our locality, we were aware 26.7% of adults are living with one long-term condition. So we have, like probably everybody else up and down the country, long waiting lists. In Scotland, we are measured within MSK services on a 4-week performance target. And basically what that equates to is referrals. They really ideally would like them seen within 4 weeks. So our performance target 2023 was sitting at 34.93%. An average waiting time of 16 weeks. We had also introduced through the recognising the waiting times that we had, the use of the MSK HQ questionnaire within our team, because staff were really aware of the complexity of referrals had changed, certainly since pre-COVID. But I think there's lots of reasons for that. We've seen in this area, there's been big investments in primary care, where we have physiotherapists sitting within primary care. So a lot of the referrals that were coming to us within the MSK service tended to be of a more complex nature. So we had already, within our service, we had taken steps to do things to try and make things as efficient as we could. So we had already developed support resources for patients. We developed an OA decision tool, which was a sort of patient information resource. As I alluded to earlier, we'd heavily invested in health behaviour change training within our staff group, really giving them the skills for motivational interviewing. We'd streamlined our processes, our triage processes, our referral guidance. We had trialled different blended and hybrid clinics to try and make things as efficient. But it was clear to us to try and tackle our waiting times that we needed to do something different. So this project really, when Greg reached out to us, this really fell to us at a really important time. So we thought, right, we really want to be involved with this. And I'm so glad that we did become involved with it, because I really do think when you look at the benefits, there's benefits for the service, there's benefits for the patients. I think there's just benefits for everybody involved. To be involved in that working relationship it's been a real joy to be involved with it. So I'm going to give you some of the benefits from a point of view of a managerial perspective, and Wendy will be best placed because she was first-hand involved with the programme to give the feedback on the patient perspective. So really absolutely cost effective for us. So that 8-week working pilot that we did, so if we compare that to what that would have cost us to do that in a hospital setting with Wendy on a one-to-one basis with patients, and for the volume of patients that were involved here, we've probably saved in the region of £1,500. The delivery of the group sessions up in Stuart and at the Wellbeing Suite, with the collaboration with the chat team, we're able to see more patients. So in a group session within the hospital, Wendy as a sole worker would be seeing 4 patients at a time. Pairing her and Kelly together, they were seeing 15 patients in an afternoon. So really the kind of staffing savings for me were to the tune of about £800. So it's a significant saving, but it's much more than the money. Do you know, we just couldn't deliver that. You know, the number of patients we will see coming through, what we can deliver in the hospital, and you just know it's just not that right fit, that behavioural change. We can't just deliver that in a half-hour session within the hospital. So the kind of slides there, I really do feel that this opportunity has not been the sole factor, but it's been a contributing factor in our performance going from 2023 to 2025. I think certainly, you know, even within those periods, we've had our struggles with staffing, we've had our struggles with recruitment, but even putting that aside, you know, we can see there within this our waiting times, there's been improvements in our waiting times, there's been improvements in our 4-week performance. And I think even what we are now starting to see is the volume of patients who are being referred specifically with ONEs into East locality has reduced. And I think that's got a lot to do with the partnership working that we're doing with our colleagues in primary care. We've done a lot of work with Linda's team in trying to streamline that activity and prescription referral and trying to make that as straightforward for healthcare providers as we can. So Wendy's going to give you a wee bit of an insight into the benefits for the patients.
Okay, so just if next slide, that's us. Yeah, so you know, as we can see, the graph, we use the MSK-HQ scores that Fiona has spoken about, and the scores really increased by an average of 10 points. And to increase by 5 points is considered a good outcome. So to actually double that is fantastic. Physical activity levels of 30 minutes, intense exercises, asked how many days they do. And the average had increased from 1.67 days to 2.67 days a week. So that was also really good feedback. We also asked for qualitative feedback. And as you see, I've kind of put it up on the slide there. But I think in summary, you can see that they all felt supported and safe to move and becoming stronger. So I revisited this week. I've actually revisited quite a few times because actually the people that the participants started coming in the group sessions after us, which was great because you could still see them on a regular basis. But I have visited them. I did take a rescore of their MSK-HQ, and they have actually maintained that high score, which that in itself is actually an amazing achievement. While we were there and working in the clinic, I also work in the knee replacement clinic for people that's post knee replacements, and I actually took a couple of patients that were struggling with flexion. We would generally have taken them to hydro, but water wasn't actually suitable for them, so I invited them to come to the hub while we were there, and they also get a big difference. So you know, it also was good as being there, that having come up when we were there and have that introduction was fantastic. Well, I would say that the biggest thing is the onward support that the groups have continued to share and the peer support. It has absolutely been heartwarming. Not only do they still meet up and keep in touch, they pick each other up, they check in when they've not attended. They've collected new members into your group. You go up there and there's somebody that you've never seen before that's part of their group when they're having their teas and their coffees. And people that have a different health conditions. There's one lady in particular who came to the group, and when she came to the group, she had 2 elbow crutches and legs like Bambi. She really struggled with her balance. And now she no longer uses any walking aids. She cared for her disabled daughter. We got her daughter signed up and on the machine safely. And she's just over the moon that she can join this club and be part of something that's actually really special. So I think the peer support is massive. I think when I refer people into AOP and I'm talking about the wellbeing clinic, I quite often say, oh, just book in, they'll be there on a Tuesday, they'll be well looked after. But I think from my perspective, I just feel the environment, the machines, the staff, it just has promotes a positive vibe, and it makes the programme really easy to deliver. And I'm sure I speak for both Kelly and I when I say it was an absolutely pleasure to be something that was actually just a wee bit magic. And I think we have got some patient stories that I think we're going to play at some point. So thank you.
Yes, I will. Let me check that I can get this to work. Can everybody see? Is that okay? Perfect.
My name's Debbie McClung, and I've been coming along to the active wellbeing suite for the last 6 months. I initially went to the GP practice with pain due to my arthritis and fibromyalgia. I got referred to Cross House Hospital to the physio department, and there was a programme which they were about to embark on in collaboration with East Ayrshire Leisure's chat team, and it was the new Innerva suite up in Stewarton, and they asked if I'd like to join in. We were the first to try out the new suite, and I have to say it's been life-changing. Barriers to exercise for me had been that when you're living with pain daily, you start to tense up, and I felt as if my body was like a coiled spring and everything was extremely tense. So coming along to the suite really helped me, because it was exercise on a machine that was power assisted, so it gave me that opportunity to have the reassurance that there was a machine there that was going to guide me and make sure my body was in the right position, which would mean that I wasn't in pain. I was really concerned to begin with because I hadn't exercised for a while, and I suppose anything new, you're a bit apprehensive. But it was an extremely welcoming experience. There was about 20 of us when we started, and it was just, everybody just got on really well. So there was a community there, so you didn't feel as if you were on your own. You felt as if that there was a group of people that understood what you were going through, and you were doing it together, so it felt like more of a sense of community. The experience has been great because it wasn't just about using the Innerva suite and the machines there to help, but one of the big things we got from the class was the education part of it. So at each session we would have an education session that would tell us a bit about our illness and things like how inflammation had an impact on the body. So we got to learn stuff as well, which really helped us to go away and manage the condition. So it wasn't just about the exercise, it was actually about the other bits that you got with it. As I mentioned, we were the first group to do this, and we got on absolutely brilliant. So we decided we were going to continue coming on a Tuesday, and we now have a group session that we come to on a Tuesday, and we still support each other as we are doing our exercise, and there's tea and coffee and a chat afterwards as well. So that's really helped us to continue, because you feel as if you've got that support from your peers, and you've also got that chat and that community after it as well. So there's an encouragement to help you to come. You're not just going on your own, that there's actually a group of people that you've actually got a really good relationship with. It's absolutely brilliant. Just the machines are designed in such a way that you can't harm yourself. You can push harder if you want to. There's different speeds. For me, it's opened up parts of my body that were so stiff and so sore, but just by having that actual movement, it's loosened them up and it helped to reduce the pain. So fibromyalgia has been probably the biggest source of my pain, and this has really helped with easing that a bit for me. I had a flare up with my back, and I had a week that I didn't come The second week I came, I was really, really nervous because I was in quite a lot of pain, but just having someone there, so Wendy was there from physio, so she was able to reassure me that I wasn't going to do any damage, and she was with me at each of the machines that day just to make sure that I felt comfortable, and it was the best thing I could do because it was one thing that helped me over that flare.
There we go, just going to stop sharing. Okay. So firstly, thank you to Debbie for sharing her story. It's always so powerful to hear from our end users, but also to Fiona and Wendy. It's so encouraging to hear the difference that partnership has made, both from a patient perspective. I mean, Wendy, some of your comments, I mean, joining the club, positive vibe, magic. I mean, that really does kind of speak to the environment that has been created there, but also on the service delivery. You know, Fiona, you mentioned kind of around cost, waiting time, alternative, not getting as many referrals in. So it's so exciting to hear about that first trial and then kind of subsequent trials that will come from that. So on to our next panelist, Linda. I'd like to bring you in now, as you've been looking at how this can extend kind of the work that you do even further. So how do you see the addition of the active wellbeing suite extending the reach of your existing referral programmes?
So Fiona and Wendy mentioned the referral programme that we have in East. Ours is called Activity on Prescription. We've been running that since about 2001. That's our opportunity for medical professionals and other partners to be able to refer individuals along to us that they feel would benefit from adopting a healthier lifestyle. One of the key aspects around that is about increasing physical activity, and over the years we've developed a programme of exercise classes following quite a bit of training across the team to be able to deal with these chronic medical conditions around cardiac disease, stroke, MSK, neuro conditions, falls prevention. The team have done quite a bit of training to be able to support people safely in a class environment that are referred along to us. But with the introduction of the wellbeing suite, that opened up a whole load more opportunities for us to get people into that gym environment where the equipment is specifically designed to be able to support them with their journey, whether they're starting from scratch or whether they're getting back into activity after a long time away and now have some of these long-term conditions. Possibly one, Wendy and Fiona mentioned the percentage there that we have across East Ayrshire that have one condition, but in quite a few occasions it's people with multiple conditions that are getting referred through to us. So the equipment's ideal for supporting them. It's power assisted, so they're eased through the movement, so it not only helps with muscles but it helps through joints as well to ease them back into just becoming that little bit more active. But I think it's already been mentioned as well around about the camaraderie that's there and the support that's offered through that group environment and the support from Wendy and Kelly, the atmosphere that they create within the environment as well. Plus, I mean, the decor goes a long way to help with that as well. It's a welcoming environment. It's not your traditional gym setup where people are going in to potentially train much, much harder. And so it eases people back into exercise. And it was ideal with linking in with the physios. We've worked in partnerships right from the beginning when the referral scheme first kicked off, but being able to do something as a co-delivery, all of the benefits that we felt from it as well are replicated from what Fiona had said and Wendy as well around about that joint use of time. So we're seeing far more people over a shorter duration of time where resources are being stretched these days. So to be able to get more out of the skills that we have from the staff and make best use of the venue, it's just been a positive journey since the Wellbeing Suite first opened.
Thanks, Linda. It's so lovely to hear kind of your positivity and kind of talking about, you know, supporting people to actually come in, it being a welcoming environment and that really aiding their journey. From the work that you've done with the MSK team, what are the key learnings that you're taking forward from that, and how do you think that will shape the way that you deliver your support in the future?
Yeah, well, I think the relationship that we have with Fiona and Wendy's been key. Coming together, designing the programme, working together, the relationship that's there has been made a huge impact on how the programme's developed and been delivered. And I think that comes across with the participants and how they enjoy taking part and come back time and time again, and then the encouragement to keep going once our block's finished is down to the girls as well, and how they've encouraged that and brought everybody together while they've been in the Wellbeing Suite. I think the skills and the knowledge have complemented one another across Kelly and Wendy from the delivery that they were involved in doing, so that it's not just about the exercise component, but it is about that self-management, the opportunity to ask questions, to clarify anything. If it's maybe not quite such a good week this week, then Wendy's there on hand to be able to talk to people and let them know that it's maybe normal for them to be feeling the way they have been feeling after taking part in a new exercise programme. So I think that skills mix, the knowledge, the relationship that's been built up, the trust in one another, that's all helped to just have such a positive impact on the people that are then taking part in the programme and the support that they then get going forward. It also helps within the Leisure Trust because that initial programme is free, but what we do is then sign everybody up because they want to continue. So they're able to sign up for a wellbeing membership and keep that group approach going and meet up with one another on an ongoing basis within the gym. So it generates a wee bit of income for the trust as well going forward. So yeah, it's all been positive. I think the relationship's one of the key things that I would say has brought this together and has made it work so well.
Absolutely, and that's a relationship that was formed at such an early juncture that has just continued to support the work that every individual is doing, and will support, like you say, this has kind of been focused on MSK, but there is so many different kind of co-occurring conditions that can be rippled out to. So thank you for sharing that. So last but not least, Julie, I'd like to come to you now because you're probably seeing firsthand that the changes that are being made to the suite since it opened. So the Active Wellbeing Suite has been open for a few months now. What differences do you see in the centre overall since you've actually added the Active Wellbeing Suite?
So first and foremost, I think probably reaching a new customer base in terms of our memberships, a wider demographic as well. So, you know, we now have an area that's open from 9 in the morning till 8 o'clock at night that is suited for individuals living with long-term health conditions who are rehabbing or prehabbing pre-surgery or pre or post-injury. So we really have kind of widened our demographic. We've increased our user figures obviously as well, and that's fantastic. We kind of run instructor-based sessions as the Leisure Trust, so kind of more commercial sessions where our members come in 5 times per week, so they can take up to 11 participants. But we also run, when that Active Wellbeing Suite is not in use, we just have it as drop-in. So that's when people will come in again, organised groups like the Tuesday session with our teas and coffees, and other organised groups that have actually developed since the opening of the suite. For instance, on a Thursday morning, we've got a group comes in, 6 or 7 ladies who didn't really know one another before, but coming into the facility the same time each week. That's what they like doing. That's what they like to come into and just kind of chat about daily life while working their way around the station. So kind of on average, through the instructor-led circuit classes, we're kind of reaching out to about 80 participants per month. And through the drop-in sessions, we're averaging about 50 per week at the moment, sometimes a little bit more, so about 200 per month for that. So that's a real increase in our kind of user figures, but also just reaching an audience that would not have walked through the doors of our commercial or conventional gyms. So that's been great to see as well. But what we've also seen is we've upskilled our staff and we have increased staff morale, increased confidence within the staff that are delivering the sessions, and more engagement with our customers as well.
So lovely to hear how the space is mixing things up, not only from who's walking through the door, but to the community that they're forming once they do. And your figures are kind of really testament to that. But it's also, I love that you mentioned the staff as well, the impact that that's having on the staff. That's really lovely to hear.
Yeah.
And so it's obviously very early days, but how do you think this early momentum will shape the direction of the centre in the future?
So just kind of going from strength to strength, really. Again, I speak very regular with Sophie from the chat team, and she has really kind of championed for the local surgeries and GPs to be involved in, not only for those that need referral through the activity on prescription, but for those that just need a bit of a gentle nudge to get back into some regular exercise. So what's kind of been established is, and a story, a good news story to tell is that one of our customers, or one of our new customers, recently visited the GP, you know, kind of on the cusp and for obesity, but was signposted back to the active wellbeing suite from the GP to come and join in with some sessions. Now, that wasn't through activity on prescription. That was just the local GP surgeries and the healthcare providers knowing about what we have in the local area and signposting people for at the right time. We're getting them at the right time before they have to go in to Linda's team or perhaps Fiona and Wendy's team, which has also been fantastic. And that's how that's how I see us moving forward, is just everybody having the right information to signpost at the right time.
Absolutely, because like you say, if you can stop them going into Fiona's and Linda's team, that's kind of taking I was going to say burden, but that's not the right word, but in terms of their waiting lists and such forth, the pressure, that's the word that I was looking for. So thank you. And thank you for bringing the changes to life. I think it's always good to hear how things are working from an operational level as well.
Yeah.
So to wrap up our panel discussion, I would like to pose a question for the entire panel, and feel free to come in as you wish. So we've obviously heard some fantastic examples today of how effective partnerships are clearly driving change. Looking ahead, how do you see the existing and new partnerships evolving further? And what impact will these partnerships bring for the local community and your organisations?
I can come in there to start with. So in terms of partnerships, they're already developing. We're already in discussions with Chest Heart Stroke Scotland, who came down to our official opening, and are very keen to find a location with East Ayrshire Leisure to have a base down in Ayrshire that they can start working from and start working with us more in terms of the wellbeing suite that we currently have. But we're also in discussions with other partners within other areas of East Ayrshire. We're strategically looking at the moment to put a business case together to expand the wellbeing suites we have, so that we can have this offer to other residents of East Ayrshire in other parts as well. So the partnerships within other colleagues within health and social care, the GPs, the charitable organisations, we're even having care homes coming in and speak to us now about the sort of blueprint that we've put together for this, that they've got spaces within their care homes and looking at what they can potentially do with it and the impact that this has had as well. So much more of a bigger collaborative approach than I anticipated to begin with, but it's really, really exciting to see of what we can take it to next. And I think, as we've talked about here, is for me, this the whole point of this for me right at the very beginning when I started this journey was I just wanted to find something that would bring people into the facilities that would never normally set foot through the door and engage with physical activity, and to create an environment that that would be suited to them, which I think we've done with the wellbeing suite. So yeah, let's just see how far we can take it.
Thanks, Greg. It's excellent to hear that the collaborations are expanding further than you originally anticipated, and that's already happening. So very exciting times. Anybody else want to come in with any comments from the panel on that question?
I think you touched on it during the talks, that although we've focused on arthritis just now with Fiona and Wendy, there are other conditions out there that would definitely benefit from coming in and using the active wellbeing suite. So we were in discussions with some of our other outpatient physio colleagues to just see if we can replicate the approach that's been developed between Wendy and Kelly, to see if that would work for some of the other conditions that we have been referred to as through the referral scheme. Excellent,
thanks, Linda. It's that ripple approach, isn't it? And the fact that you've got such a successful trial to talk about is really strong to kind of bolster those conversations. So good, excellent.
I'll just come in finally with, from the venues perspective, for ourselves, we've got numerous groups that have used or are showing interest in using the suite, and that includes our walking football group. We also have a Parkinson's table tennis group that come in who have been shown round the equipment and really enjoyed their session. And we've also had external physios reach out to kind of gather some information and come up for site visits, etc. So from a venue perspective within the area, that's kind of like further partnerships that we're developing as well.
Yeah, it's really exciting. Do you find it goes the other way as well, where people have joined the active wellbeing suite and then are keen to look at kind of other things within the centre at all, Julie?
Yeah, we're kind of getting to that stage now where some of the people users are maybe kind of able to come in and use some gym equipment, etc., or going in and doing some social sports within the facility as well. So yes, definitely seen a bit of cross use, which was what the aim of the game is at the end of the day, to make sure that people are participating in exercise regularly.
Absolutely. Especially with it being National Fitness Day, it all ties in very well, doesn't it? That this is the aim of the game, that we're looking at supporting a different demographic in, like you say, kind of building on their fitness journey and kind of having that as part of their lives. So thank you for sharing.
From our perspective, within MSK teams, we've taken the opportunity to try and get the majority of our MSK team up using the equipment, just being familiar with what it is. You know, I just think that way of, if they can see it, they understand it, they're more likely to, you know, put that into their toolkit of, you know, modalities of treatment and things that are on offer. I think we've spread that amongst our MSK OTs that cover with the help us with the sort of mental health side of things. So we've embedded it there, and we've really joined in with our primary care team, physiotherapy teams. So we've had lots of good communications, as Julie said, with Sophie as well. We've had lots of good communications. The practice manager at Stuart Health Centre has been a dream to work with. The nursing team there have been so receptive to everything, and that's then been spread through an Ayrshire-wide platform as well. So I think the kind of next steps for us is then starting to target some of the other GP practices within our locality to try and get get that similar momentum going. And I think, you know, it really is exciting to think if we could have funding and for possibilities of other suites within the locality, I think the future's looking bright. So, yeah.
Communication and collaboration is key, is the message that I think is really coming through from everything that you're saying. So that's, yeah, indeed, the future's looking bright, very exciting. Well, thank you for the panel, and unless there's anything else that anyone wants to share, we'll go on to the questions from the audience. So feel free to pop any questions that you have in the Q&A section. I know there are a couple in there. Let me just get them ready. It's loading up. Apologies, my system is moving very slowly.
Liz, I'll come in with the first question just to help.
Perfect, thank you.
So Sarah Burns asked a question, and she's obviously applauded the work that you do and said it's a great concept. She just wanted to know, was the initial trial free of charge, or was there a nominal fee to get participants engaged?
I could probably come in there just now. I'll talk to you about the pricing model that we use here. So as I mentioned at the start, the whole point of this was not to approach healthcare partners to say, come and use us and then we'll charge you. So what we do is Fiona and Wendy and the team are working with individuals, and they'll bring them along to the suite. We won't charge for that at all, to allow the opportunity to take that cost barrier away, and to allow the healthcare professionals to come in with their clients to get them familiar, used to, comfortable within the environment. The referral program that we talked to there about the arthritis, again, that was 8 weeks, there was no charge to the individuals at that point either. And what we then do as they are ready or able to enter the activity and prescription program, which is with Linda's team, we have introduced an active wellbeing membership, which we are we've put in place. It's for 12 months with the support of the activity and prescription team. The first month's free, and then we charge £10 a month for the remaining 11 months, and that allows them access to the wellbeing suite, to the referral class program, to our swimming pools, and to our main gyms as well when they're ready. And for me, the payback on this is going to be that after that 12 months, we can convert them over to one of our mainstream memberships, because by that point, we're hoping that it's an integrated part of their daily life. And that's when we would see the payback on it. Now, to give you an example, we launched the membership round about the summertime, and it was only just within the Rosarelli Centre to begin with. And then we rolled it out to some of our locations that the referral classes are taking place, which some of those facilities are cap transfers within communities. We've just got about 240 members that have signed up to the wellbeing membership so far within a couple of months, and that was just promoting at one site. So we see that there. So you can do the maths and see the additional income that we're bringing in from that. But if we can get those individuals then to convert over into one of our mainstream memberships, then that's where then we see the kind of financial payback from that point of view. So does that answer the questions? I help?
Yeah, no, I think that's very much covered Sarah's question. We do have another question from Gary, who actually runs an active emotion in Northamptonshire. And Gary, I think that will cover the funding part of your question, but in terms of the trial, there was a question of how many sessions per week were participants in attending, and what were the tests that were measured throughout that programme?
So the programme was once a week, and as Fiona discussed, we used the MSKHQ, which is a versus arthritis self-efficacy score, which can actually give you a full range of how people are feeling, not just their physical activity. It's quite it's a self-efficacy, so it looks at all the things that they're managing, so it gives you a full picture of how they're emotionally, physically and mentally managing.
Excellent, thank you very much. A question from John Hymas. So as well as co-hosting the training with health partners, was there any further or additional engagement activity that was undertaken with other health partners to promote the active wellbeing suite? For example, local GPs visiting the suite, physios, kind of externals. You're nodding vehemently there, Wendy.
Yeah, I think at the opening of it, you know, the kind of invite went wide. So there were local GPs, nursing team. There was quite a wide variety of people involved in that. I think that is just something that we're still continuing to try and build on, just to make people aware that it's there and the benefits that can bring.
Excellent. And this is probably a question for you, Fiona, and Wendy as well. With the 3,500 MSK waiting list, have you seen a reduction in the numbers of the list due to this project, or is it too early at this stage to tell?
I think it's too early at this stage to tell, and I think, you know, there's so many other variables that come into a working day for us to say that, you know, just, you know, staffing challenges, you know, so there's lots of components to it. But I think about what we could see is looking into that, the test and the feeder that we used was the clinics that we had for OA&Es, and I think definitely what we're seeing is there's a change in pattern there. So I think, you know, that, you know, a combination of wait and well information, referrers being informed and what options are, and I think, you know, Julie even alluded to that earlier on, where people have been, you know, go and have a try at this before coming to us, where, you know, previously it would have been that model of the pathway was let's get you to physio and we'll decide. And I think the other thing that I think in time might have the potential to have an impact is us having access to the centre and the relationships we've got, you know, from a whole public health perspective, we've got information being shared up in the sports centres. You know, there's the, you know, the tools that we have devised, the sort of arthritis self patient informations and stuff where they can access our website and information within the leisure centre. So there's a lot of shared information going on there, which I hope in turn will help.
Absolutely. Sharing knowledge is power, they say, don't they? So it's great to hear what has happened and what's going to continue to. So that brings us to the end of our webinar. If anybody does have any questions or would like to follow up, then please do. And I hope that you're all leaving with the inspiration of our panel and what they've shared today. A massive thank you to our panel, to Greg, Julie, Linda, Fiona and Wendy, and also to all of you for joining us today. There will be a recording that will be sent round, and please feel free to reach out if you have any questions. Thanks again, and happy fitness, happy National